Osteosarcoma types. How to ensure an accurate diagnosis. Imagine trying to solve a complex puzzle without all the pieces. That's what diagnosing osteosarcoma can feel like without the right approach. Accurate diagnosis is essential because it guides treatment and helps predict outcomes. To get it right, doctors use a combination of clinical evaluation, imaging, biopsy, and lab tests, all working together. First, understanding the different types of osteosarcoma is key. There are primary types that develop directly in the bone and secondary types that happen after other bone conditions or treatments. The most common is the conventional or intramedullary osteosarcoma, which usually appears in the long bones of teenagers and young adults. It's high-grade and can be osteoblastic, chondroblastic, or fibroblastic, depending on the type of tissue the tumor cells produce. Then there's the low-grade central osteosarcoma, which is less aggressive and rare, often seen in young adults. Surface osteosarcomas, like periosteal and periosteal types, grow on the outer surface of bones and tend to be less aggressive. Older adults might develop secondary osteosarcoma, often linked to conditions like Paget's disease or previous radiation therapy. Knowing these differences helps doctors plan the best treatment approach. Next, doctors relying heavily on clinical and radiological assessments. They start with a detailed patient history, looking for symptoms like persistent bone pain, swelling, or fractures caused by weakened bones. Imaging tests such as X-rays, MRI, and CT scans help visualize the tumor's size, location, and whether it has spread. For example, X-rays might show a mix of bone destruction and new bone formation, which suggests osteosarcoma. MRI provides detailed images of soft tissues and helps determine how far the tumor has invaded nearby structures. These imaging results are also used to stage the cancer, which is vital for planning treatment. However, imaging alone can't confirm the diagnosis. That's where biopsy comes in. An experienced surgeon performs a core needle or open surgical biopsy, carefully choosing the site to avoid contaminating surrounding tissues. The tissue sample is then examined under a microscope. Pathologists look for malignant cells producing osteoid, which is the hallmark of osteosarcoma. They assess the shape of the tumor cells, their nuclear features, and how actively they are dividing. The tumor can be classified further based on the predominant tissue type, like osteoblastic or chondroblastic. Sometimes, additional tests like immunohistochemistry or molecular studies are used. For example, markers such as MDM2 and CDK can help distinguish low-grade osteosarcoma from benign bone tumors. Genetic testing may reveal mutations in genes like RB or P53, which are common in osteosarcoma, but these are not used routinely for diagnosis. Differentiating osteosarcoma from other bone tumors is also crucial. Conditions like chondrosarcoma or Ewing sarcoma can look similar on imaging but requiring different treatments. For example, Ewing sarcoma often affects younger children and has different genetic markers. Accurate diagnosis depends on integrating clinical findings, imaging, and pathology results, which is why a team approach is essential. Orthopedic oncologists, radiologists, pathologists, and medical oncologists work together to interpret all the data. In summary, ensuring an accurate diagnosis of osteosarcoma involves a careful, step-by-step process. It starts with understanding the tumor's type and behavior, followed by detailed imaging to assess the extent. A well-planned biopsy provides tissue for microscopic and molecular analysis, confirming the diagnosis and subtype. This comprehensive approach helps distinguish osteosarcoma from other bone conditions and guides the most effective treatment plan. Always remember, each case is unique, so consulting a specialized medical team is the best way to get personalized, accurate diagnosis and care.